Hi, my name is Mercy Oluwatomilola Adewumi. I'm a medical laboratory scientist.
And I am Omoleke Akintunde Abisoye. I'm a medical practitioner.
All right, so we're here to answer a simple question, maybe not so simple, as regards the healthcare system in Nigeria. How do we step out of a failing system that has conditioned our minds to be failures?
Okay, and to answer this question, it's actually important for us to understand that this is actually the situation that we find ourselves in Nigeria, especially zoning down to the healthcare system in Nigeria. We have a system that is sponsoring, directly or indirectly, the massive exodus of medical practitioners outside the country. We have a system where the healthcare system is so disorganized, where everybody is trying to do everybody's job and there is less emphasis on specialization and all of that. And Mercy, I think where this problem actually started from is about the fact that the Nigerian system, some way, somehow, have other priorities that I find very difficult to define, that they think are more important than actually than the healthcare itself. And I say this with all due respect because I understand that there might be a lot of things complicated about government and politics that I might not be able to put utterance to in this video. But I think what we have as a reality is the fact that medical practitioners are being trained by our system and they are going out, and even those that are staying are not really getting the needed expertise or professionalism that they require, that they need. And this question becomes important to answer because, especially for some of us that might still be in this system or hope to stay a little longer, a little further, or to still do one or two things, how do we ensure that we are not just boxed up in a system that is not set to favor us? How do we ensure that in the nearest future we are not saying that, oh, the only reason why I didn't reach the peak of my career or achieve the dreams I actually longed to achieve was because I just happened to be in a failed system? So what do you think about this?
All right, I feel that the first way to actually step out of this failing system, because we all have to call a spade, it's not working. So if it is not working, maybe it's failing or it is failing. So the first thing is, one thing I've observed over time, or based on my own personal observation again, is that the system that trained us in itself, like the educational system for healthcare professionals in Nigeria, is actually quite deficient.
Faulty.
It's
really
very, very faulty. It's scary because we were just packed with knowledge. Most times you fill your head with a lot of knowledge. You just read to pass an exam. In my own, I know that we still have the grade system. You read to have a first class, you read to have a 2-1, you read to get out of school with a good result. Probably for those in nursing or in medicine, for example, now you read to ensure that you don't fail your MBBS. So you just read, pack yourself with knowledge, and then there are some aspects, maybe for somebody like me, or maybe somebody in generally, yourself with so much knowledge that are not exactly applicable, or that you begin to forget, or that you don't lay emphasis on. So I think the first thing is we need to retrain ourselves, because if whether you're going to stay in Nigeria or you're going to go outside the country, you have to be quite vast in knowledge. And the truth is, like I said earlier, what we are given in Nigeria is not enough. Because as a biomedical scientist, when I want to compare my training as a Nigerian to compare to that of somebody outside the country, there were practicals that we did in school that the methodologies that we were taught, maybe the last time they used it was 1990. And that's the methodology that we're still being trained with in Nigeria. So it becomes imperative for me as a medical laboratory scientist to look out for the latest and ongoing innovations in medical laboratory science and retrain myself to it. It boils even down to research methodologies. For most of us that did our undergraduate project research, we just did it to have an A in our project. We just did it to defend our project. Not so many of us were actually research driven. We just wanted to do projects. So some of us were handed topics. I think that's not so good. Some of us were handed topics, so you just work on the topic that your supervisor suggested that you work with. You have your topics. Some of us even had topics that we were quite passionate about, but probably because there were not enough resources, we had to drop those topics to look for the common ones that we can easily have access to. All right.
Sorry to cut you in on that, Mercy. I think that at this pace, maybe somebody is even finding it difficult to realize how bad things have gone. And something cropped up in my mind while you were talking about that, and that is the fact that I was trying to imagine what would the Nigerian healthcare training system look like in the absence of exams. Now, I understand that exams are an indispensable part of the training and they are essential. But of course, we have programs in developed countries where you necessarily do not have to, all through the time lag or the space of when your program will be spanning through. You don't necessarily write exams as such. Of course, you do tests, there are quizzes, there are assignments, there are project works here and there, and all of these are the things that culminate into your assessments, that culminate into the grade systems that you're given. But unfortunately for us in Nigeria, in a system where everybody just wants to pass exams, and after
Yeah.
passing exams, you realize that the practicality of what exactly you learned or you were trained for is totally absent.
Okay, it's even very scary because in a bid to pass exams, I know there was something funny on maybe Twitter some years back that I read that the person was begging medical practitioners, please don't cheat in your exams. Please don't cheat in your exams because we don't want you checking Google when there's an emergency situation in the hospital. So yes, we need to, like I was saying, we need to go back to retrain ourselves. If you are studying on, maybe for example, let me pick a common one, diabetes for example, you want to check on, as a medical laboratory scientist, you want to check on the current trend in diagnosis of something like diabetes, cancer, all of those things. I know that, okay, fasting blood sugar, that's the common one that we do. Are there already advancing innovations in diagnosing all of these ailments? What is my role as a 21st century medical laboratory scientist in healthcare in 2025, as at the time of this recording? What is my role? Am I just to do PCV, do sorry for this, WIDAL, do FBC? Well, I believe you understand the reason why I had to quote WIDAL, do FBC and just do 2-HPP, just do liver function test. Like, how do I not, you have to ensure that you are not backward even as you carry out your practices. So
Okay,
let me allow you to
I would say looking forward, I think one thing that we might need to do as healthcare practitioners, this might be very important for the government, but aside from that, even as individuals, learning from or speaking from the point of view of a particular TED talk I was listening to a few days ago. So there was this journalist who was giving a TED talk, and she made mention of the fact that in her first year of training in the US, she was given a project, and that project inferred covering the presidential election, the US presidential election, together with some other persons that was happening in the US as at that time. I think the president that was contesting them was Barack Obama, if I'm not mistaken. And then that struck a chord in my heart to the point that a first year journalism student, or whatever you want to call it, was actually being exposed to that level of practice. And I think the same thing would actually apply if at all we are going to step out, like you quoted it in the question, step out of a failing system that is set to make us think and look like failures. I think medical practitioners would need to start owning up to the responsibility of trying to see how they can present or position themselves for opportunities for training and retraining, and not just taking everything as books and books and
Yes.
books as usual. I know that this might come as an added effort on the part of the medical practitioner, but I think on the long run it will pay, because on the long run you realize that it's not just about the certifications that you have. Oh, I have this PhD, MSc, BSc, BA, whatever you want to call it, but about what can you do, what can you offer. And I say this to also, I would like to also add that in this regard, if you look at an average healthcare provider that was trained or that is being trained in Nigeria, if you compare such a person to somebody who was trained abroad, it looks as though an healthcare professional is being burdened by, or is being pressed down, quote unquote, by village people. And then all of a sudden, it seems as though the moment the person steps out of the corridors of Nigeria to better climes, it seems as though village people automatically turn back.
Withdraw.
I think the difference is that the kind of training that they are exposed to over there involves practical knowledge, hands-on experience, and that is one thing that we might need to incorporate in the Nigeria of today. And I say this especially to healthcare providers, healthcare practitioners, or providers that will not be considering the JAPA that is trending now. I'm not necessarily saying anybody should go, neither am I saying anybody should leave. I'm just saying that if you're going to be staying, it will be important to position oneself in such a way that when advances, when innovations, when improvements, when upscaling comes to a healthcare system generally, it doesn't meet you
Reaction to it.
unawares. You are not you are not cut out of the bigger show. You are not cut out of the bigger show. I think that is very important as healthcare providers.
I think another thing I want to emphasize, or probably something we will talk about with the medical practitioner and the medical laboratory scientist, is this rivalry that goes on.
Oh,
It's very funny, but so painful. It's so painful because it seems that we're supposed to work together, but it seems everybody's trying to fight for a win. Everybody's trying to fight for themselves. And yes, I know that there is a lot of back and forth, a lot of justifications. In fact, if we're going to make this a very, it's enough to be a 2 hour conversation. But
let me give an example on that. You know, sometimes when patients are told to do this common routine, this common investigation that gynecologists often require. Now, I'm speaking of Nigeria. Now, what we have that is what we have applicable in Nigeria, high vaginal swab or endocervical swab. So there was this argument on the medical platform that was ongoing at the point in time concerning whether endocervical swab should actually be what should be requested from patients or high vaginal swab. And for all we care, we just realized that from your own end in the lab, most of the patients that were doing high vaginal swab were coming. You know, you just realize that they say after whatever house of culture that what the cultured was normal flora. I mean, how do you talk about normal flora for somebody who was obviously having clinical signs and symptoms of the disease condition, only for us to realize later on that because of the bridge in communication between those in the clinics and those at the lab, there was already misinformation or paucity of information given to the patient. Patient goes to the lab to get high vaginal swab done, gets the lab scientist hands over the swab stick to the patient. Patient with the mind that patient is returning back to the clinic. The clinic gets to the clinic, just gets to the restroom and just does whatever right there, and that is all. So I think maybe that maybe medical communication or health communications, as I would put it, is also another important part of all of this. To the point that we do our job or do our work with the kind of standard that is applicable, that is available out there, with the kind of training that is applicable and available out there, to the point that if we are not now expecting or we are not getting the same results that they are getting over there, we know that okay, maybe it's now totally just the system that is at fault. I'm not exonerating the system. I'm only saying that let us firstly ensure that from our own ends, as practitioners in Nigeria or that will be in Nigeria for a while, we have to up our games. We have to do more than what we are currently doing at the present moment.
so I feel that in addition to that, we need to return passion to our work. I feel that maybe
But
because
passion
of
is difficult when there's no money.
that's what I wanted to say, that probably because of
What
the
is passion in the
economic
face of
situation in
hunger? I mean,
Nigeria. But then we cannot remove passion entirely because when there is passion, that it's passion that makes you realize or see the pain to empathize with your patient. And because you empathize with your patient, you want to go to all lengths to ensure that your patient is fine. But if it is just about the money, if it's just about clocking in the morning, clocking out in the evening, and probably doing local late in the night, you might just miss out on actually providing the kind of standard healthcare that your patients require. So yes, I think it's time to begin to teach, like I mentioned earlier, educational system. It's time to teach passion again instead of rivalry.
so
Let everybody be passionate about
let me call this my own final notes, and let me say that maybe beyond passion, because I know that will probably be the reaction of somebody who is seeing this video now. I think beyond passion, maybe it will take a healthcare provider who has a sense of purpose and permits me to use the word calling in healthcare to really outdo themselves and put all of this in place. And what I mean by that is that how do you talk about passion for a doctor who has seen 120 patients in a clinic on just one day? How do you talk about passion for a healthcare provider, a lab scientist who is not even able to afford their bills? I don't know if you understand. So it definitely would just mean that there has to be more than that. And maybe it will just mean that there has to be something more than what is external, something within. And I really hope that we're going to get there someday. I also hope that this will be a wake-up call to our governments, to assistants, to make us realize that there's a lot that can be done on their end to actually help to avert all of these problems.
So how do you step out? Number one, you educate yourself. Number two, offer value. Number three, passion, or much more than passion, purpose.
Yeah, and a sense of calling. Yeah.
And a sense of calling. Any other thing?
Maybe that would be my final notes. If you have any other addition, you probably do us the favor of
To hear from you.
getting across to us. Thank you so much.
Thank you. Bye.
You're welcome.